Hi, my name is Annie Lilligren and I am a student nurse midwife at the University of Minnesota. Research shows that routine use of continuous electronic fetal monitoring does not improve outcomes for mothers and babies. It is associated with increased rates of cesarean sections and unnecessary interventions throughout labor. Many institutions are increasing utilization of intermittent auscultation, or IA, for low-risk laboring women, which in turn supports and increases rates of normal physiologic birth.
Yes.
To successfully perform intermittent auscultation, there's a couple steps you need to perform. First and foremost, you want to perform the Leopold's maneuver to determine the fetal position. Once that's done, you are able to determine the position of the fetal back, where you will be placing the doptone to determine the fetal heart rate. Once you find the fetal heart rate, you want to listen for 30 to 60 seconds to get a good baseline rate. At that point, you then want to palpate a contraction and auscultate at the same time, and you want to listen through 2 contractions and 2 resting periods. At this point, the nurse will then document her findings. The findings to document would be the baseline, the rhythm, and if the nurse heard any increases or decreases in the heart rate. If any decreases were heard, the nurse would then put the patient on the electronic fetal monitor. You may have noticed that I've been using a little different terminology that you may be accustomed to. For intermittent auscultation, instead of using a variability, we use rhythm, so regular versus irregular. Instead of accelerations and decelerations, we say increases or decreases. Every low-risk laboring woman should be determined for eligibility of intermittent auscultation upon arrival to the labor and delivery unit. With all that being said, we are now going to demonstrate how to use intermittent auscultation on a laboring patient in different positions. This is Christy, and she is a low-risk laboring patient that just arrived to triage. We went through the checklist, and she is technically a great candidate for intermittent auscultation. I am now going to walk through the steps of intermittent auscultation. First and foremost, I'm just going to lift up your shirt here, Christy, as you perform the Leopold's maneuver. I feel a head. And I feel the fetal back over here. I'm going to now turn on my doptone. Woo! Okay. I hear a heart rate. And I'm going to now listen for 30 to 60 seconds. And at this time, I'm also going to determine mom's heart rate to make sure that I have both. Perfect. Christy, your baby's heart rate is about 130 right now. All right. So now we're going to keep monitoring through 2 contractions and 2 resting periods just to determine your baby's response to the labor, and then we'll get you up moving around, okay?
Sounds great.
Okay.
Thank you.
You're welcome. All right, so it's been 30 minutes since we last listened to Christy's baby's heart rate. She's been walking the halls and working hard, and now it's time to listen to her baby again since she is in active labor. So when we did Leopold's, we know that the baby's back is on the right side, so we're going to go down here. And now we are going to listen through 2 contractions and 2 resting periods. It's also important to keep in mind that intermittent auscultation is great in all positions. All right, so it's been another 30 minutes, and now we're going to auscultate one more time here and perform IA. So she is in the hands, knees, using the cub right now. So it's important to remember that when the mom's position changes, so does the baby's. So you might need to go a little bit lower when you're auscultating or trying to find the baby. Let's sneak in here, Christy. And also, always remember to palpate the abdomen to determine the strength of the contractions and how long they are lasting. Don't forget to listen through 2 contractions and 2 resting periods for at least 60 seconds after the last contraction. You have now seen how to initiate and perform intermittent auscultation while women are laboring in a variety of different positions. Remember that intermittent auscultation is the standard for all laboring women unless they meet the criteria for continuous fetal monitoring. Hopefully this video has increased your skill and comfort with utilizing intermittent auscultation on your laboring patients. In turn, we will have increased support for normal physiologic birth. Thank you for your attention.